Hello, today we're going to be focusing our attention on reproductive health, justice, and rights. We'll be considering the many ways that reproductive rights are also human rights. First, let us begin by defining health. The United Nations World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. According to the Universal Declaration of Human Rights, everyone has the right to a standard of living adequate for the health and well-being of himself and his family. To live a long and healthy life is an integral component of human development, and in fact, health has been established as a human right. Now, women face a number of challenges to their health and well-being. For example, HIV/AIDS, violence against women, high rates of cancer. Now, these are all important health issues, but today we're going to be focusing on one aspect of women's health. We're going to focus on reproductive health. Although it is important to remember that this is not the whole of women's health, it's simply one piece of the puzzle. Reproductive health is important for a number of reasons. For example, over 500,000 women die each year from complications during pregnancy and childbirth, the vast majority of them in Africa and Asia. This includes nearly 70,000 deaths from unsafe abortion. In fact, for millions of women around the world, the time from conception to the month following the birth of a child can be the most dangerous period of her life. For women who live in sub-Saharan Africa, for example, this is a long period of life-threatening danger, as a woman might spend 2/3 of her time between the ages of 17 and 35 pregnant or lactating. A woman's ability to exercise her right to health does not depend solely on the availability and affordability of health facilities and services. Too often, women face an additional barrier to access to health care. For example, discrimination, both within the health system and beyond in society as a whole. Because women are often faced with gender-insensitive health care, they're often denied the power to make their own decisions, and often treated as undervalued members of their communities. They do not receive the health care they need when they need it. We might consider a reproductive health and justice framework to understand many of the reproductive health issues we'll examine today. Loretta Ross, a U.S. reproductive justice activist, defines reproductive justice as the complete physical, mental, spiritual, political, social, and economic well-being of women and girls, based on the full achievement and protection of women's human rights. In this understanding, reproductive justice is the right to have a child, the right to not have a child, and the right to parent the children we have, as well as controlling our birth options, such as midwifery. The reproductive justice framework is very important because it highlights the role that class, race, and gender play with regard to reproductive health. There are many violations of women's human rights that are specific to health and reproductive health. Some of those violations of women's health and human rights are perpetrated just beyond the mainstream consciousness of public health practitioners. So, for example, looking at practices like virginity tests. Now, some of these practices are just whispered about or perhaps on occasion confronted, but rarely receive the spotlight or outrage and evidence-based scrutiny that's necessary to stop harmful practices and violations of women's reproductive health rights. Family planning is a key aspect of reproductive health. An estimated 228 million women who want to delay or cease childbearing and are in need of an effective contraception, yet 38% of all pregnancies are unintended. What this tells us is that many women want to control the number of children they have and when they have children, and they want to use contraception. But it also tells us that many women have accidental or unintended pregnancies as a result of often failed contraception, lack of contraception, or misinformation about contraception. When we look at the US, for example, there's 60 million women in the US who are in their childbearing years. Now, your average childbearing years are 15 to 44. Now, of course, women younger than 15 and older than 44 certainly can and do give birth, but 15 to 44 is the average age. Now, reproductive health impacts many aspects of women's lives. So, for example, when women can control their fertility, they're in a better position to make other decisions. And as such, family planning is a human right. Now, there are many reasons why women often can't control their fertility. For example, there are some national laws where you need a husband's permission to use contraception. In other cases, while it may not be law, it's cultural norm. So, for example, in Pakistan, you culturally and unofficially do often need your husband's permission to obtain contraception. In Afghanistan, where women have often limited mobility and freedom, this can restrict their access to medical care and access to contraception. There are also many cultures where it is emphasized that women remain virgins, and so access to contraception might be blocked due to expectations that women should not be having sex. As a feminist perspective, we need to use intersectionality as a way of understanding family planning, especially the role that contraception plays. The best method for one woman may not be the best method for others, and certainly one's class and one's race will often dictate the type of contraception available to you. Maternal health and human rights are an important aspect of reproductive health. Now, when we consider health generally, there are micro-level factors that influence someone's health, such as their diet, whether they smoke, how much stress they're under, but there's also macro-level factors. Now, these macro-level factors, for example, socioeconomic status, are often referring to the conditions and global forces that obstruct the attainment of women's reproductive health. Now, there's many factors that impact women's reproductive health. These would include family planning, as we just talked about, but also maternal health and human rights. We need to ask ourselves, can she control when and with whom she will engage in sexual relations? Can she do so without fear of infection and unwanted pregnancy? Can she obtain a safe abortion? It's clear that reproductive health and rights are the cornerstones of women's empowerment, according to the United Nations Population Fund. There is no single cause of death and disability for men between the ages of 15 and 44 that is close to the magnitude of maternal mortality and morbidity. Every year, 500,000 women die giving life, and many more suffer irreversible injuries and disabilities. Now, what's important to remember about maternal mortality is that it is an avoidable and preventable tragedy, and it represents the most apparent violation of women's right to life, health, and equality and non-discrimination. If you look at the chart in the current slide, it helps us see that much of maternal mortality could be prevented if women had access to skilled health workers. Midwives were trained. These are just some examples of ways that we could prevent not only maternal mortality, but infant mortality as well. Population policies play an important role in women's reproductive health and are often a source of violating women's human rights. Now, what is a population policy? A population policy refers to any policy adopted by a government or organization that's aimed at reducing or increasing population growth rates. Now, most of you are familiar with population policies that aim to reduce population. So, for example, China's one-child policy is commonly cited as an example where attempts to restrict the number of births that women have. Now, population policies are deeply intertwined with controlling not just women's fertility, but efforts to control society and which populations of people give birth. Now, when we look at women and how women are affected by population policies, what we find is that women are often the victims of forced sterilization. And this is a violation of the reproductive justice framework as defined by Loretta Ross, because it prevents women the right to have a family. This prevention of women having children is a form of abuse. Now, forced sterilization and also forced IUD placement is often practiced against people of color and especially Indigenous persons, and is currently practiced worldwide. In the United States, for example, the U.S. managed to sterilize Native American populations, with an estimated 40% of Native American women sterilized during the 1970s. This is just one example. Also, other examples include Angela Davis's comprehensive historical account of the way that African American women were often forcibly sterilized by the U.S. government through welfare programs. Davis provides evidence that, for example, in North Carolina, between 1933 and 1973, 7,686 sterilizations had been carried out, about 5,000 of which had been black. Now, that number and figure is later updated to a much larger number by the Department of Health as this problem was investigated. In other words, one of the things that feminist scholars like Angela Davis want us to understand is that coercive methods of forced sterilization often include financial incentives, a lack of consent, and these policies are aimed at deeming some women, in particular women of color, disabled women, as another example, using the law to deem them feeble-minded, dependent, and diseased, and incapable of regulating their own reproductive abilities. So within this framework, we see racist and sexist ideologies at play in an effort to violate women's human rights. Unsafe abortion is another violation of women's reproductive health. You can see from the slide that an unintended pregnancy is the root cause of most abortions. So we must ask ourselves, why do unintended pregnancies occur, and how is that related to contraception rights? We do know that regardless of whether abortion is illegal or legal, women continue to choose abortion. The key difference is that when abortion is illegal, it becomes more dangerous. In other words, women are likely to die from unsafe abortions and suffer other health complications. Now, women choose abortion for a number of reasons, including finances, career, health, contraception failure, relationship with parents, being a rape survivor, religious and political values. Yet abortion laws vary widely and depend on the country. Now, what we find is that when women can't obtain legal abortions, that they're often risking their lives and their health. Now, political policies play an important role in shaping women's reproductive access to abortion. If we look carefully at something called the Global Gag Rule, this is officially termed the Mexico City policy and refers to the practice of withholding U.S. aid from any entity that mentions abortion in its literature or performs it in practice, even if the education or practice is financed by funding from other sources. Now, the Global Gag Rule was first a product of the Reagan administration. It began in 1984, but with each president that takes office in the U.S., this policy has changed and corresponds greatly into the political party. So, for example, Clinton, as a Democrat, repealed it. And so we see this Global Gag Rule fluctuate depending on who's in office. But essentially, what it does is it helps restrict access to abortion, and in practice, defunded many women's health organizations around the world and affected other aspects of women's health. It's arguably one of the most problematic foreign policies, and it affects women's reproductive choices globally. Now, there are many reproductive health activist organizations that are aimed at challenging some of the violations of women's human rights. So, for example, the Women's Global Network for Reproductive Rights is one such example of networks that aimed to challenge neo-Malthusian discourse, which would tell you that there should be a superior race and population control as an effort to obtain that. Now, this is obviously deeply problematic in terms of racism, but also sexism. This particular global network also challenged religious fundamentalist positions that opposed sex education, contraception, and abortion. So, in other words, part of what we see is global efforts to increase sex education, contraception, and to fight for safe and legal abortion. Now, the ICPD is essentially an international conference on population and development that established that women have the right to be free of discrimination, coercion, and violence. It was held in Cairo in 1994 and marked a significant moment in human rights and women's rights because it marked a paradigm shift in terms of understanding women's health from population control, which had dominated the debates, to reproductive health generally. And so this was the first time that we see gender equality, women's rights, and empowerment recognized as an essential development goal. Now, feminist human rights vision of reproductive health. For example, reproductive rights are human rights which are inalienable and inseparable from basic rights, such as the right to food, shelter, health, security, livelihood, education, and political empowerment. And so the reason this becomes significant is that it's positioning reproductive rights as one of the basic human rights that's already been established through international law. Now, globally, in 2000, the United Nations Millennium Summit, which comprised of 189 nations agreeing to the set of 8 Millennium Development Goals. These goals, often referred to as MDGs, are very important to women's reproductive health. They were set a target date to be achieved by 2015, and they wanted to address critical development challenges. Among those goals was to improve women's maternal health, promote gender equality, and empower women. Now, the ICPD Program of Action and the Millennium Development Goals are critical steps towards the promise of global improvements in women's health, although a lot of work remains. Specifically, we are not on course to meet the MDGs by 2015. But notice the quote from UN Secretary General Ban Ki-moon: "We must not fail the billions who look to the international community to fulfill the promise of the Millennium Declaration for a better world. Let us keep the promise." In other words, thinking towards the future, while we may not be able to meet the MDGs by 2015, we need to continue a sustained effort to improving women's health, women's development, and women's equality.